Thank you so much to our panelists for two great discussions. I think at this point we'll open it up for questions, and I'll start with one question I have. One thing that struck me in watching the amazing presentations today is that a couple talks have pointed out that cyberbullying, which was something that you all discussed, is very low prevalence among the elementary and the younger age groups. But we know that among adolescents and young adults, cyberbullying is one of the most common kinds of cyberbullying. And I think that a lot of the potential for interventions to prevent or reduce cyberbullying does seem very promising to place it within technology. I really enjoyed seeing some examples of other types of technology interventions in the health realm that could potentially be models we could think about for cyberbullying. But my question is, how can we think about what sort of frameworks that we would use in those interventions? A lot of what you pointed out has more grounding in more adult learning and more cognitive behavioral therapy or motivational interviewing techniques, but many of the bullying interventions that target younger kids look at more socio-emotional learning. So how can we learn from all of the great work that's happened in the past on bullying prevention, but then adapt it to both a new platform as well as an older age group?
Well, I think that we have to find a way to make it engaging. But even with cyberbullying, it's important for kids to have a lot of information. So, for example, when they talk about, they'll call it drama and trash. I think it'd be great to have an engaging way to give them the information about what they're doing and is it hurtful. So I think that we can take facts that we know, and rather than presenting it, the way the teachers would present it, we can actually present it in an engaging. It has to be short, engaging, interactive, but there's so much information for them to know. So, for example, when they say they haven't been cyberbullied, but then you say, well, tell me about what goes on, they as they're talking about it, they will talk about it being hurtful, they talk about that kind of thing, but they haven't put that together. So putting it in a way that is helpful, short, but informative can get them thinking. And again, if it's not happening just on a one-shot deal, but they get different messages, I think that could make a difference.
So what's interesting is that it seems like cyberbullying is more common. It's not. So when we talk to adolescents, so 14 to 18 years of age, we've got rates of in-person bullying about 30%. And cyberbullying is closer to like 17%, 14%, 16, sort of in that range. So it's you're twice as likely to be bullied in person than you are online. But that said, so I think that whether or not you're being bullied online or you're being bullied in person, that the internet is a place that we need to make sure that we have interventions, and that we can't forget sort of school-based intervention and other in-person interventions. So that said, the HIV work that we're doing is both in Uganda and here in the United States is for 14 to 18-year-olds. So I think that we can sort of translate. We can, the importance is having a theoretical model. And so, here we're talking about social emotional learning. So you've got a theoretical model, and you say, okay, well, what are the concepts that we need to be talking about this week? What are the skills that we need to be building and then reinforcing this week? And I think one of the things that's particularly challenging when we consider technology-based interventions is that we know in order to affect behavior change that we need to have enough exposure to actually change behavior, right? That's why these one-shot interventions don't work, because it's not long enough. And so the same thing is true with technology. How are we going to get them not only to come to our site, but keep coming back, so that we ensure that they have enough exposure, so that it's not just that they've got 1 day's worth of information about empathy and perspective taking, but that they've got sort of the entire 5 weeks or however the length of the program is.
Great, thank you so much. There's a question.
Yeah. Can I just add one thing? In the study we're doing right now, we're finding the exact same thing, that cyberbullying is much less prevalent than traditional bullying. And I think, again, it's important. It just speaks to the need to identify the facts and the myths that come up.
Hi, I'm Jana Juvonen, and I talked here earlier today about the importance of social context. And one thing that I've been really curious about and trying to understand better in the context of cyberbullying is the electronic environment. And I can't think the world of me who published this, maybe one of you, a recent finding where it was shown that kids report that they are less likely to intervene in the cyber context with bullying than they are face-to-face. And that really puzzled me on one hand, and I'm curious how you think about what are some unique features of the cyber environment that may prevent kids from intervening. On one hand, you think that it would be easier, especially if the message can be sent privately to the recipient of the bullying. You know, hey, I just saw that nasty message, you know, so-and-so is a mean person, for example. So kids presumably don't do that, and the question is why?
Well, I think we don't have a lot of information yet about how many do. I think that one of the big issues in cyber is that because there's the sense of it's impersonal, there's less pressure on kids to do something. Just like it's easier to send it, to just press send, even though they might not want to. So I think that's part of the education that they need, that they don't realize that while they're being witnesses, that it actually can make a big difference for somebody. So I think that there's that disconnect, which, and ironically, they often talk about it being anonymous, but then when they talk, you see it's not anonymous. So I think, again, they need to have that information.
What she said. No, we think of it being anonymous. I'm just going to build on that. And actually, the majority of bullying episodes, they know who the bully is. Young people use technology, use Facebook, use social networking sites to extend their in-person relationships, not to have different relationships. They basically just want to keep hanging out with the kids they're hanging out with in school. But I do think that it's different if you have to sort of stand in front of somebody and see their, the whole face and space crumble in front of you, right? That just has a different salience than online, where you aren't as connected with their reaction. I think working on that might increase the bystander.
Hello, my name is Becky Yoder, and I'm with the Family Violence Prevention and Services Program at the Administration on Children, Youth, and Families. I just wanted a chance to bring into this discussion teens, teen dating violence, adolescent relationship abuse, and their use of technology there. I mean, that's where a big overlap with bullying is happening, because you're finding these teen partners who are in relationships. Our Liz Claiborne study is showing that some of them are texted 30 times an hour. Where are you? What have you been doing? I mean, bullied by their dating violence partner. 1 in 4 have been called names, harassed, put down over their cell phone and over email. So that type of thing is really where we're seeing this connection come through. And it's so important when we're thinking about cyberbullying that we're not just thinking about, well, like where we started to go, it's not just the people that you don't know, or that they're putting up the MySpace pages, which is so old, I know, and flaming people on there, but they're doing other things to the people that they know within that. And the National Dating Abuse Helpline is really a peer advocate solution where young people are going and they're texting, they're going online, and they're not so much calling, but it's available via call, where they can talk to a peer about their relationships and whether they're healthy. And we fund them at the FIPSA program, and they're just coming with us saying we're just getting so many youth who are contacting us not only about dating partners, but just friends who are exhibiting these behaviors. And they might not be calling it bullying, like our speaker said before, but just so important to bring these two issues together, and I just wanted to bring that out there, so thank you. Mm-hmm.
Can I just say, I think that's so important, and I think it's an area that we haven't really, it doesn't get talked about. There's, the revenge porn sites, there's all of those sites, and we, sometimes by just calling it all cyberbullying and not identifying the specifics, really misses that. But I think that's really a critical issue it's hidden. It really hasn't come out yet to the public.
And I think that this idea of sort of growing and making sure that the support that we do have online are sort of meeting the current needs and the communication strategies that young people are using. So making sure that there's a real-time online chat option and that there's a text option is critical. And I'm not surprised at all that very few kids are calling in, right? Because who talks on the phone anymore? Old people, right? We do, but they don't, and it's not that they don't want to talk to somebody, because for them, IMing is talking. They just want to talk in a different way. And so making sure that we not only have spaces and places online for them to go to, but that they have a way for them to connect in a way that they are most comfortable, I think is really key. So,
Great points. Next question.
Get down to my level. I'm Katie. I'm with the U.S. Department of Health and Human Services. I just thought it was really interesting when we looked at some of the, I guess, social marketing related to health prevention. And I did my master's in communication, and I looked at HIV prevention. This was years ago, before the internet completely exploded. But we had really found that you need to go where people are to really reach them. You could, throw something up on a website, put a poster up, but if that's not where they communicate, that's not where they live, you're not really going to reach them. And so I think what's so interesting and important with this topic especially is that teens are online all the time, not even online so much, they're on their phone, or they're on their, Snapchat or Facebook or whatever is, the platform that they choose to use. And I just think it's interesting and disappointing in a way that there hasn't been much more research and strategies at looking at how we can do that better, how we can better reach them through the means where they always communicate and where they live in their sense. So I appreciate all the thoughts that you all offered, but if you have any additional information of things that are maybe coming down the pipeline that you think would be good strategies on that respect, I'd love to hear about it.
So I can just sort of build on that. I don't have the answer, but I think it's really critical as we begin to think about sort of the next steps to recognize that just because we build it doesn't mean they'll come. I mean, we were so excited, right, when the internet first came. We were like, oh my God, we're going to change the world. We're going to put together 5 different websites for 5 different health conditions, and everybody's going to go to our websites, and we're going to change the world. Well, it turns out that particularly for this type of intervention, you have to be self-motivated. Because the benefit of a school-based intervention is we've got a captive audience. It doesn't matter if you want to opt in to bullying prevention. We're going to talk about bullying prevention today. Whereas if it's online, we don't have that same control over the audience. And so the kids have to be interested themselves. And it particularly helps if they're already where they are. So if they don't necessarily have to go anywhere, then it makes it more likely that they might be exposed or sort of be willing to sort of sit through it. So thinking about how we can, integrate content in Facebook, for example, or integrate through Snapchat. But I think what's also important when we start thinking about those things is making sure that they're sort of transcendent, so that they'll work on Facebook or Snapchat or Pinterest. Because if we're just going for one particular social networking site, then we're constantly going to be chasing after them, because the internet is constantly evolving. So I think it's less about one particular space and place that they're at now. It's about understanding where they're at now and developing interventions that can be sort of slotted in wherever they go.
Next question.
Hi, I'm Deborah, RFK Center. I really appreciate the fact that you both focused on sort of the more educational aspects of prevention. But I think when a lot of folks think about cyberbullying prevention or intervention, they think along the lines of what one California district just did, which is adding tracking software and monitoring the Facebooks and Twitters of all of their students. I have my own opinions about this, but I would love to hear your thoughts about school districts doing this, parents putting spy software on their computers, et cetera, et cetera, et cetera.
I guess my bias would be, rather than do that, I think it'd be really good for school districts and parents for us to find ways to have an interaction so that children and youth can respond to professionals online, so that can be available, because they're not doing it now offline. And I agree that it has to be very accessible. We have to go to where they are. But if it's on the platforms they're at and they see, okay, there's a way that I can contact somebody about this and just write something, and a professional will write back, a school professional or whoever. I think that's the way. I think the problem with just tracking and monitoring and spying on them is that we know they'll find other ways to do it, and we want to open up the conversation, not close it. And it's already pretty closed, so I would say to really make that available. And I think along with that means that we really have to give information to parents and adults to help us not overreact and freak out without minimizing it, because obviously it's a serious problem, but when we react and go to the extreme, kids shut down.
Yeah, I couldn't agree more. I actually was just talking with a parent the other day, and she was explaining to me, how she was monitoring her children's cell phone use, and, the kids knew that at any time she could, demand to see the cell phone, and that this was sort of, going to be helpful in ensuring that they were using their cell phones and texting appropriately. And the same thing with online. And I said, well, but what would you do if you didn't have the phone? Like if if there wasn't this actual physical piece that you could demand, what would you do? She said, oh, well, I talked to him about it. And I said, exactly. And I think that we sort of, I think that depending on what is going on in that young person's life, monitoring is sometimes warranted, and certain degrees are warranted depending on their age and what else is going on. But I think too often we sort of then think that our job's done, right? You just sort of put on the software, you sort of have these, sort of monitoring things in place, and that's all you have to do. But I think it's the conversation, it's the connection, it's exactly what Dr. Mishna was talking about, that is critical. And that's what we need. We've been talking today about not just what we can do with kids, but what we can do with adults. And I think particularly with parents, we can help them gain confidence and self-efficacy in terms of how to have these conversations with their children, because it's not necessarily they don't want to, it's that they may not be thinking about it, and if they are thinking about it, they may not feel like they really have the skills and the strategies to do it.
Dr. Rivera?
I guess I'm just a little skeptical about how we get through all the massive media exposure that kids have. So it's one thing to have a study of 100, 200, 300 kids and the control conditions like that, but thinking about taking this to scale that's available to kids in the United States or Europe or wherever. I mean, how do we really do that? And is it feasible for us to get through this mass of cyber media, that would be necessary for kids to be able to use this?
Yes. I think it's hugely, hugely critical to think about. And I think that it depends on the topic and it depends on the group. So for example, what we're finding with our HIV prevention program, which is really being talked about as sort of healthy sexuality, and what teen guy doesn't want to talk about sex, right? So we've, in terms of recruitment and being able to get guys to self-select in and stay in, it's phenomenal that there's a huge demand for that particular program. So going to scale with that is, I have less concerns. Whereas with Dorothy and I, we're currently in the field trying to recruit for focus groups for our bullying prevention program, and we're getting no love. And we're trying to figure out why. Is it because kids don't really want to talk about bullying? Is it because our recruitment strategy isn't right? Or what is it? Because not only is it making it difficult to sort of do the focus groups, but it certainly is then making us think further about sort of the then what, because this is for this particular topic and this particular group. It doesn't look like what we're doing has good evidence in terms of being able to scale it up later. So I think it's complicated, and the only way you learn about the kind of stuff is by beta testing it. But absolutely it matters, and that it, the two critical pieces are, what do you want to talk to them about? So are they motivated to talk about what you want to talk about, and who is the group you're targeting?
Great. Well, I'll ask a question then. I can't help thinking, I'm an adolescent medicine physician, so I'm always thinking about the spectrum of adolescence, that some adolescents, we would include high school in adolescence, but also now as we're understanding more about adolescence, really we need to be thinking about those post-high school grads and college students. And I think there's been much less attention to bullying in that college student and post-high school, but the studies that have looked at cyberbullying have suggested rates of around 20 to 25% of college students report cyberbullying. And it gets complicated because cyberbullying starts to bump up against sexual victimization and sexual harassment. So how do we think about ways to engage with this population, to use the right terms to be able to assess as well as deliver interventions in this population?
Well, I think that's a great question, and it's coming up. I know in Canada, it's just recently at several universities, this issue has come up. So I think that what the universities are doing, and I think makes a lot of sense, is they're having task force with students and professors involved to start to identify the kinds of issues. And again, people before talked about climate. A lot of it is the student climate, and much of it is stuff that has been around for a long time and not questioned. And now that it's in the cyber world, it's become more dramatic. So I think we have to really begin that conversation, but students need to be involved, and again, they all need to be involved and start to plan a kind of holistic way. But I know in Canada it's a priority now across all the universities.
Other questions from the audience? Do we have any web questions? Okay. Anything else? All right. Well, thank you so much to our panel, and we'll have Dr. Rivera come up.
Thank you very much, and thank you to all the panelists for a terrific day. We'll end here. I feel like that Far Side cartoon that says, "Teacher, my brain is full, let me out." We've learned a lot today. Tomorrow we'll reconvene at 8:30 in the same room and to continue our discussions. And for the student panelists, we're going to just touch bases with you now in room 125, which is out the doors to the right. Thanks very much.